I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for January 28th. One of the most dynamic topics recently has been vaccine mandates. Many have asked why we haven't imposed more mandates, and others have spoken out against any vaccine requirements. I'd like to frame how we approach those questions in Marin. First, there's no question that our greatest asset as a county right now is our high rates of community immunity gained through vaccination. Marin is an outlier nationally and is among only a handful of counties with vaccination rates above 90%. What's even more remarkable is that before COVID-19, Marin was noted nationally for being vaccine hesitant. In 2015, our rates for required childhood vaccinations were among the lowest in the state, and we had the highest rates of whooping cough, a vaccine-preventable form of pneumonia in children. Jimmy Kimmel even called us out, saying local parents are more afraid of gluten than they are of smallpox. So the culture has clearly changed around vaccines. I'd like to share our strategy that we've used here in Marin over the past 5 years to increase vaccination rates. That strategy has been built on 3 pillars: education, access, and policy or mandates. Of these, education is the most important and nuanced, so we'll start there. We don't view education as just teaching the public about the safety and efficacy of vaccines. While that's necessary, it's not nearly enough. Instead, we see education as being in both directions. We as healthcare and public health leaders are also being actively educated by our community about their specific concerns or doubts. The act of listening and gaining a better understanding inspires trust and allows us to meet people where they are and to show understanding. We also see education for us in public health in looking to the science of psychology and decision-making, as much as the science of clinical trials, the biology and immunology of vaccines. Where vaccines are a choice, it's important to understand how people make decisions and what they're afraid of. What that looks like for us in Marin, in practice, has been a lot of dialogue and surveys and open conversations. It means doing a lot of listening in the exam room and in community forums. At the same time, we know that since the dawn of vaccines, historically, there has always been a subset of people who are just anti-vax. That group is much smaller than they seem. It's important to recognize the difference between those who are fixed against vaccines and those who remain open and are looking for the best possible information and looking for who to trust. We learned that those who are hesitant in our community, for them, community members and peers, friends and family are far more effective than top-down public health messages. The next pillar is access. This is an obvious one and should go without saying, but everyone needs free and convenient access to vaccines. Vaccine equity has remained a key focus for us in Marin, and we've worked hard in low-income communities to remove financial, cultural, or logistical barriers to access to vaccines. And then, finally, the last pillar, when needed, is mandates. After educating ourselves and our communities as well as we can, using trusted voices and removing barriers to access to vaccines, we may then need mandates if our rates are not yet high enough to protect our community. That's why, for pockets or sectors with low vaccination rates, the question of mandates remains active. The reason mandates come last is that we always seek the least restrictive approach, that we know building trust is a delicate process. When introduced early, mandates can polarize the conversation and lead some who are on the fence to a more fixed opposition. This could actually lead to lower vaccination rates overall, depending on the setting. In Marin, the numbers speak for themselves. With over 90% of our population vaccinated, we have clearly benefited from the choices that our family members, friends, and neighbors have made. Still, the most direct path to a more protected Marin is through even higher rates of vaccination and boosters. We'll get there through our proven strategies of education, access, and only when needed mandates. Let's build on our strong foundation as a community that embraces vaccinations. Thank you for doing your part.